Hi, everyone. I'm Jess Chu, VP of Marketing here at Trella Health. And today we are talking about referral targeting strategies. I am joined by Teresa.
Hi, I'm Teresa Buglione. I'm the Director of Services here at Trella Health. I've been in the post-acute care space for about 15 years. I've done everything from working as a clinical consultant, helping folks with their marketing teams and business development strategies, to implementing point of care software, and now here at Trella Health.
Awesome. So let's start by talking a little bit about targeting strategies. I mean, why are they important? How do organizations use them? Where do you start when you start working with our customers on targeting strategies?
So the first thing I usually start with when we're working with our customers is I ask them, do they have a plan? We can get into targeting strategies and how to use them, but I always say, what's your plan of attack? Drilling down into a strategy is great, but let's take a look at where you are. Are you going after physicians or hospitals for specific diagnostic categories? Are you doing it by territory? Are you looking to grow just based on one major diagnostic category or a specific disease state or disease program? So answering those questions helps them put a plan in place first. Where do I want to spend my time? Once I know that, then I say, okay, then these are the type of targeting strategies we have that we can help you to drill down even further. Usually most people start with physician targeting strategies.
And I know one of the most common ones, which is the one we're going to deep dive on today, underutilization. So
Yes.
talk a little bit about underutilization. What does that even mean? And how do you determine who falls into that category?
So we do have a global filter view that can be utilized on the solution that you can pull in, but underutilization is usually a physician who has a large number of patients, but a small number that are actually being referred to or utilizing post-acute services, whether it's home health, hospice, or skilled nursing. And in order to see that, you can look at their utilization percentage, what's being referred out by county and state averages. And also when you look at their destinations, they have very small numbers that are going to a very small number of post-acute providers.
And so once you've narrowed it down to who the underutilizing physicians are that you want to reach out to, what are some common metrics or messages to approach those types of physicians?
Some common metrics that I always tell them they want to look at when they're looking at those providers who are low utilizing is, first off, when you're talking with them, ask them why. There's always a reason why. I think that's a question a lot of marketers are afraid to ask. Why? What are the needs of your patients? That's number one. Number two, some of the metrics I look at is the number of patients which we have in our solution that actually go to home health versus that don't go to home health. It's always good to do the educational piece as to the value of those post-acute services. And then what do you offer? I think sometimes doctors may not know what you offer. What do I offer? Is it infusion services? Do I help endocrine patients? What is it that we do that's special that would be ideal to help the needs of their patients? So I think those are the things I always tell them to look at. Also, when you're looking at the physician, look at their major diagnostic categories, their breakdown of their patients. What is their area where they're spending most of their time? Do they have mostly respiratory? Do they have mostly endocrine or diabetic patients? CHF patients, so you know exactly. You want to go after metrics that's important to them for their patients and then start the conversation from there.
Yeah, it definitely seems like this is a group of physicians who really need to be educated on the value of the post-acute care setting for that particular agency. That's
Yes.
Interesting.
Yes, and also showing them that a lot of patients, especially those who have chronic conditions, post-acute care services can help prevent hospitalizations. A lot of times doctors will wait until there's what we call in this industry an event, meaning they've been in an inpatient stay, they've gone to the ER, they've been under observation in the unit at the hospital. And then after this event, then they say, oh, you need post-acute care services, versus I've been treating this patient and I'm seeing they're struggling. Home health in particular can help actually manage these disease states to prevent a hospitalization, especially those chronic conditions. So sometimes getting them to really understand that we're here to help you, and reduce that admission, and then why wait till they go into the hospital? So having that conversation to educate them that we're here to help prevent things and increase outcomes so the patient can do better is why we're here.
That's perfect. Yeah, it's almost as much awareness about, home health or hospice as it is awareness of your own agency.
Yes,
Perfect.
absolutely.
All right. Well, thank you, Teresa. And
Thank you.
Yeah, and if you're watching this and you have more questions or you have a specific targeting strategy that you'd like us to talk about, feel free to email me. It's jess@trellahealth.com.